This is Captain Kevin Garneau-Bégin here. I'll put my video so you can see my face. I'm still in the office. So people call me KGB, my initials. I'm the flight surgeon here in Geilerkirchen, Germany, and I oversee the medical care of the military folks posted to Europe and the Middle East. So my colleague Sue, a wonderful nurse, started this health services webinar series back in October, and she discussed at the time the topic of menopause, which is a commonly talked about subject, as the symptoms of women undergoing hormonal changes around the age of 50 are commonly experienced. And as a follow-up conversation about this women's health topic, we decided to discuss the men's health issue of andropause, or the hormonal changes that occur as men are aging. So andropause, or male menopause, or what doctors describe as late onset hypogonadism, so complicated words, but late onset hypogonadism is the medical condition. It's a result of decreasing level of testosterone as we age. And this decrease of testosterone causes a variety of non-specific symptoms that include low libido, decrease in energy, changes in body fat distribution, and we'll review these in more detail throughout the presentation. So this talk is supposed to last approximately 30 minutes, like we said, I'll be answering questions at the end of the presentation. So the goals of these presentations are mentioned here on the slide deck, and I must say that research about andropause are few compared to menopause. And there are still some controversies that remain in the medical literature, especially about whether or not we should be replacing with the medication testosterone this relatively common and normal decline of testosterone in aging male. And also, there's some controversies about the complications and the risks of testosterone therapy. We'll talk about that later. So next slide. So what is the definition of andropause? So we talked about it already. I'm just going to repeat myself because repetition is good. So as men age, the concentration of testosterone decreases over time, and this decline is sometimes referred as andropause, or late life hypogonadism, or testosterone deficiency syndrome. So different words to mean the same thing, so decrease of testosterone. So unlike menopause, where there's an almost complete estrogen deficiency with known clinical consequences, this decline in testosterone in aging men is modest, only small, and the consequences of this testosterone drop has not been well established and well studied, and we're still learning more about that. So if people want to understand andropause, we need to understand how what testosterone is and how testosterone is made. So this is a review of a biology textbook. I'm not too sure if you remember your biology from high school, but here this is within the brain, so the pituitary gland here. So and over here, this is the testicles, so where testosterone is made. So androgens are steroid hormones that control the expression of male sexual characteristics. And testosterone is one of many androgens, and it's produced by the Leydig cells within the testicles. It's found next to the tubules where the spermatozoids are produced. So, and this production of testosterone is stimulated by the brain, by a brain hormone called LH. So it's a complex biochemistry process that is outside our scope of discussion today. And then testosterone, which is produced by the testicles, is then released in the body and then transformed to other molecules in human tissues. So basically, people need to understand that testosterone is produced by the testicles, and its production is stimulated by a brain hormone. And testosterone deficiency can be caused by multiple different reasons throughout different stages of your life. So children can get testosterone deficiency, young adults can get testosterone deficiency, or more commonly we see testosterone deficiency in older males. So we divide those different causes into primary hypogonadism, so primary cause, which is a defect in the testosterone productions in the testicles. So let's say you've got trauma to the or irradiation to the testicles, and then the cells are not producing testosterone. It's the primary issue, primary hypogonadism. And there's also secondary hypogonadism issue. A lot of complicated words here, but it's basically a defect in the brain hormone secretions of LH and FSH that causes a lack of stimulation of testosterone production. So let's say if someone has a brain tumor, prolactinoma, so pituitary tumor, that can cause a secondary hypogonadism issue where there's not enough brain hormone to stimulate the production of testosterone. So it's likely like that andropause, this late onset low testosterone, it's caused by a combination of issues here. So first, that the Leydig cells are not as productive as what they were when you were 20 years old, and by the fact as well that there's a bit of a decrease in secretion of LH over time. So that is why andropause occurs. So we're still learning from it. This is just an hypothesis. Next slide here. This is a graph. So testosterone can be measured. So it can be measured simply by doing some blood tests. So there are two kinds of testosterone out there that can be measured in the blood. So the total testosterone and also the free testosterone, or the bioavailable testosterone. So there's a natural decline of testosterone level as men age here, mostly after the age of about 50 years old. So this natural decline is relatively small. So I know there's a steep curve here, but this steep curve is not that steep. People go from about 18 nanomoles per liter of total testosterone when they were 20 to about 12 nanomoles per liter of free testosterone as they get to 70 years old. So that represents about 0.4%, so less than 1% of testosterone concentration fall per year. So a fall of about 0.4% per year is not that much. There's a more steep decline in free testosterone in people's blood as well, and that decrease in concentration, it's about 1.3% per year, according to a study of European males of about 3,000 people. So as opposed to women, which have a rapid and sudden stop of estrogen production by their ovaries when they reach around 50, the men continue to have testosterone floating in the blood even when they are 100 years old, just in smaller amount. And that being said, most men, even when they get really old, maintain testosterone levels within the normal reference range. There are certain medical conditions like obesity or diabetes that have a higher prevalence of reduced testosterone level, but this is the majority of people maintain normal testosterone level. So how do we diagnose testosterone deficiency? So as a doctor, I diagnose disease, right? And there's a difference between this natural decline of testosterone production versus a disease state. So a diagnosis of hypogonadism or testosterone deficiency requires both symptoms and also low testosterone levels measured in the blood. There are certain issues, though, when we measure testosterone levels. So first, the issue is that blood testosterone levels varies throughout the day. So that if we measure your blood testosterone at 7 a.m., it's likely to be higher than when we measure it at 7 p.m. So there's a wide variations throughout the day, and there's a wide variation from one person to another, and there's variations from 1 week to another. So there's a cutoff point of what it is to have low testosterone. Typically, when testosterone are below 12 nanomoles per liter, people may benefit from testosterone replacement, but there's still controversies at what's considered low and not low. All right, and then next slide is the signs and symptoms associated with testosterone deficiency. So there are many consequences of this testosterone decline with age. And I must remind here listeners that the correlations are not known with certainty, and the changes mentioned, the signs and symptoms here are likely multifactorial, not necessarily due to low testosterone levels. So first and foremost, sexual function. So sexual function measured by the frequency of intercourse and sexual satisfaction and libido is less in older men than in younger men, and this is likely attributable to lower testosterone. Second thing, a big point here is bone mineral density in fractures. So as men age, their bone minerals density, so the bone mass, declines, so it decreases over time, and the risk of fractures, as in women also, increases. And this is likely due to a lower testosterone in people's blood. Also, muscle mass. So we know for sure that testosterone stimulates muscle mass and strength, and the decline in testosterone will cause you to have a lower muscle mass and a fat mass that increases over time. Another big point here is anemia. So anemia is having a low level of hemoglobin or a low level of oxygen carrying capacity in your blood. So anemia is quite common in older men, and this may be caused by low testosterone, because we know that people that receive testosterone therapy, it increases their hemoglobin production. Another interesting fact here is that the hormone testosterone affects mood, and research has shown that low testosterone, so in other words, that people in the lowest 20% range of testosterone were at greater risk of development of depressive symptoms over time compared to those in the normal range. So raising the testosterone concentrations will also tend to improve people's level of energy and people's mood. And last point is that the testosterone hormone tends to play also on neuropsychologic function, which is very, very interesting, where there's some studies that shown that men with low testosterone had significantly lower scores on verbal and visual memory, and a faster rate of decline in visual memory. So the hormone testosterone, we don't know how it plays, but affects neuropsychologic function. So testosterone, just to summary here, testosterone plays an important role for sexual function, but also for bone mass, bone mineral density, muscle mass, as well as anemia and mood, and also neuropsychologic function. So how common is it? Is testosterone deficiency something common? Well, unlike women who at one point their ovaries will stop producing estrogens, we know that for sure, men will continue throughout their life to produce testosterone, but just at a lower rate. So they did a study of about 3,000 men, and they looked at everybody's testosterone, and they found that people that had symptoms of low testosterone and that had low level of testosterone, less than 11 nanomoles per liter, they found that in the population, 2.1% had those criteria. So in the general population of men aged 40 and above, 2% of men will meet those criteria. And that level, of course, tend to increase over time as men age, which is expected. This 2% overall prevalence rate tends to be on the low side, so this is a European study. There's other study coming out of China and South Korea where that prevalence of testosterone deficiency is much higher, where we're talking here 10–15%. And then in certain demographic populations of chronic disease, people with diabetes, that tend to be even higher. So it's not that common, but it's something that we see. All right, so you might think about, oh, do I have signs and symptoms of low testosterone or low T, and you want to screen to see if it's the case. There's a website and screening tools out there. So this is the libido.com question. I'm going to share that with you, a web browser. All right. All right, I'm sure people can see here where you can go on that website, and then it's of course a testosterone. It's a pharmaceutical company here. I don't get any money for them, but yeah, it's a pharmaceutical company producing testosterone replacement, and then you can do a questionnaire here called the AMS questionnaire, which is the Aging Male Symptom Scale. So it's a 17. It can do that test by beginning questionnaire, and then you can do that test and then rate yourself, and then if you have a score higher than 27, they'll tell you at the end that you need to see a doctor to test yourself for low testosterone. And then they ask questions for well-being and libido and all that. And then there's also the ADAM questionnaire that is only 10 questions, the androgen deficiency in aging males questionnaire. It's an easy test. So you can do that test here, and do you have reduced libido? Yes, no, blah, blah, blah. And at the end, they'll tell you, oh, there's a risk that you might have low testosterone. Go see your doctor to get tested for low testosterone. So we don't, I'll just stop sharing here. So as a doctor, it's not something that we screen frequently. In the military, we don't screen for low testosterone on a routine basis. We'll screen people that present with with signs and symptoms of low testosterone, but it's not something that we do routinely. But if you want to ask yourself, oh, do I meet the criteria? Then it's a good way to start. All right. So as we talked about at the beginning of the presentation, aging is one cause of having low testosterone, and the most common cause in adult males. But there's other reasons that must be ruled out prior to making that diagnosis. So when you see the doctor, and if the doctor tells you that you have low testosterone, then there's other tests that needs to be done to rule out that you don't have any pituitary tumor, which are extremely rare, but we don't want to miss that. So if the initial level is low, then there's going to be another repeat blood test. We're going to measure it again, and typically we measure the testosterone level in the morning when we know it's at the highest, and then it's repeated twice. And then we do also other blood tests to make sure that other things are ruled out. So no study has revealed that a single testosterone threshold reliably separates those who experience signs and symptoms of testosterone deficiency from those who do not. And we don't know whose men that has low T that will respond well to treatments there. So when we test for low testosterone, we test those that want to undergo treatment with testosterone replacement, but we're not sure. We're not too sure what threshold people should meet in order to start therapy. There's still ongoing research about that. All right. So next slide is a short video, a YouTube video from I think a news agency in the States. That was done a few years ago. It's only 3 minutes, so it's a good video to talk about this. The society is changing, right? The society wants doctors to prescribe testosterone, but there's risks and that people need to be aware about this testosterone therapy. There's this latent desire, to reverse the effects of aging, as seen in this video, not at least more so for male virility, right? There's been waves of rejuvenation foolishness over time with futile hopes and wishful thinking about reversing this effect of aging, and this was expressed by this painting here in the 16th century called the Fountain of Youth, where there's this legend of a spring that restored the the youthfulness of anyone drinking its water. And you can see here it depicts old bodies, mainly women, entering a pool and emerging as youthful figures. So this rejuvenation deception occurred again in the 20th century with the marketing of testosterone pharmaceuticals. And then it's reshaping a little bit for men this desire for older men to treat and replace this natural decline of testosterone, because it does have its benefits, as shown in the video. Of note that testosterone was produced artificially in 1935 and started to be marketed in 1940. So this has led, of course, to misuse amongst older men, but also amongst younger men. So I'm in the military. I do see some, younger men going to the gym, wanting to be very muscular and asking for testosterone by the doctor, but they don't meet that low testosterone level. So this testosterone misuse has increased over time. And testosterone, I need to remind people, it's an anabolic steroid, and it has a street value, like any other drugs. So the most common form of androgen misuse is the progressive increase of off-label prescribing of testosterone and as an anti-aging boost for men, and also for women. There's some women that uses testosterone. So this increase in prescribing of testosterone is mainly confined in North America, in the USA mainly, but there's also an increase in global sales for any lack of proven and safe benefits of its use. So we need to be careful here not to assume that this andropause phenomenon necessarily means a disease state that needs testosterone replacement. The andropause is not like menopause, which is an age-related, menopause is an age-related hormonal deficiency state. The decline in testosterone in aging men is modest, and its effect is like on any other hormonal system in the body as we age. We still produce hormones, but it's just at a lower rate. So there's this slide here. So this slide was published in a Canadian Journal of Medicine in 2015. So there are potential benefits and harm of testosterone supplementation in men, as described on this slide here. So people with low testosterone taking testosterone replacement, they'll likely have an improvement of their mood, level of fatigue, and also their libido. But they can also develop some aggressive behavior if they take too much testosterone. There might be some also increased risk of cardiovascular disease. So it's a significant risk, and also maybe an increased risk of prostate cancer, although that has not been confirmed, it's just in theory. But younger men taking testosterone, they'll have testicular atrophy, and they can possibly become infertile as well. So these are risks that need to be taken into account, and it's not every man that has just only benefits. There's always harms to any type of treatment. So I think this is it. This is already the conclusion. So I just want to conclude by saying that there's a small, modest decline in testosterone as men age, and this decline is commonly referred as andropause. This decline of testosterone causes low libido, low energy, maybe low mood, maybe a bit of osteoporosis, maybe a bit of anemia and decreased muscle mass, depending on the amount of testosterone decline. Most men don't need testosterone therapy. Only about 2% of the aging men populations have abnormally or considered to be a normal low testosterone level, in which testosterone replacement may be offered. And blood tests are required to make a diagnosis. So if you want to contact me, this is the phone number at the clinic in Guyler-Kirchen, so you can call the receptions and make a telecom with me, or you can send me an email at my Force's email address. And that concludes the presentation. Thank you for listening.